Okay, so we have your dietary analysis here that you did for where you recorded your food that you ate for 24 hours. So we as dental personnel, we like to talk to our patients about their diet for many different reasons. We like to take a look at your diet and show you the foods that you eat that can contribute to dental caries and periodontal disease. And we also teach you about the foods that you eat that can help prevent them or just healthy for you. We also can counsel our patients regarding their diet following like an oral surgery on what you can eat and what you should probably try to avoid for a few days to a few weeks. And just overall, we teach our patients how their diets can have a part in periodontal disease and how to prevent that. So if we take a look at your dietary analysis, if we take a look at your patient weight, looks good, your height is good, so that all, and your BMI adds up good to that. You have 30 to 60 minutes per day of moderate activity. That's great. So for relevant medical history and medications, it looks like you are taking 4 medications orally every morning, and the medications do not impact your saliva. For medical history, it does say that you have a crown and you do have several fillings, and having a crown can actually increase your risk for periodontal disease because the bacteria can get up through the crown and actually cause cavities. So that is a thing to, kind of be aware of. It says you don't take any dietary supplements, so that's good. When we get to the nutritional health checklist, the only thing you have checked on here is that, yes, you do take 3 or more different prescription or over-the-counter drugs daily, which we just went over. You take 4, so that's good. So if we go to the diet portion where you documented your food for 24 hours, so for breakfast, you had protein waffles and maple syrup. So protein waffles would obviously be under the protein food category. And for maple syrup, I did put down that it does have some added sugar in there. For a snack, you had some cheese, pistachios, and steak strips. So the cheese would go under the dairy food group, pistachios, probably whole grains, and steak strips would go under the protein. But for steak strips, I did also put that it has an increased sodium content on there. For lunch, you had salad, a hard-boiled egg, cottage cheese, and salad dressing. For a snack, you had a chicken breast, which would go under protein. You had white rice, which would go under the grains. And for dinner, you had a protein shake, milk, Gatorade, and breaded chicken meal. I did put that the Gatorade does have some increased added sugar. The milk would obviously go in the dairy section. The protein shake would probably go in the dairy and protein because there is milk in the protein shake. And you also said you had a breaded chicken meal, which would also go under protein. And then for a snack, you had chocolate milk and Cheerios. Cheerios would be grains, chocolate milk, dairy again. And for Cheerios, they do have an increased risk for added sugar. That is one thing for that. So overall, the foods that you did consume in the 24 hours were pretty healthy foods overall. There are some that I put can contribute to caries and periodontal disease because of their added sugars. The cheese can actually help buffer those acids and actually help prevent against caries and periodontal disease. So eating cheese is good. So I actually put you at a low to moderate risk for caries because you do have some added sugar in there, but you also brush and floss twice a day, I'm assuming.
Yeah.
And you eat healthy foods, so that's why it's pretty low to moderate for caries risk. And also, if you go to the myplate.gov app and you enter what you eat, your diet, it actually gives you a total caloric need. So you need 2,600 calories to maintain a healthy weight. And for that, it says you need 2 cups of fruits per day, which we need to improve on. That could be one of your goals, is to improve on fruits. You need 6.5 ounces of protein per day, and I think protein's perfect. You definitely have enough protein in your diet, so that's good. It says you need 3.5 cups of vegetables per day, which could be another goal we can improve on, because I didn't really see too many vegetables except for a possible salad. You need 3 cups of dairy per day, which is you're good on. Your protein shake had dairy, your milk obviously is dairy, and your cheese had dairy. And you need 9 ounces of grains, and it looked like you had rice in there, and you had enough of that, so that was good. So basically your goals could be just to have more fruit, have more vegetables, and 2 strategies to do that is just incorporate more in your diet, daily diet, and just try and plan ahead. Just make sure you buy more of them and just incorporate them in your diet. But overall, you have pretty low risk for cavities and you have very good diet, so I think you're doing good.